Coronary artery disease is essentially a disease of the vessels that are feeding the heart muscle. So it's typically a plaque buildup within the vessels that leads to a deficiency in the blood supply to a part of the muscle. What we know is that coronary disease is as prevalent, if not more prevalent, in women as it is in men.
About 4.5 years ago, my younger sister died of a heart attack without any warning. Before that, I had no idea I was at risk. I thought heart disease affected grandfathers.
Women don't do well with this disease. A part of that is because we don't recognize it. Part of that is because women don't recognize it because they delay presentation. And part of that is because physicians are not applying the same level of treatment and prevention to female patients.
Having a sister who died at age 39 from this disease meant that my risk level was very, very high.
Risk factors are very important. I mean, those risk factors that you can do something about, you can actually change, and they're risk factors that you really can't do anything about. So things such as your age, your gender, your family history. There's a whole host of risk factors that you can change. First and foremost, I think, is lifestyle. So being active and having a healthy diet.
Before my sister died, I had no idea I was at risk for heart disease. I believed, moms running their kids around and doing family stuff were perfectly safe from this disease. After my sister died, although I had no symptoms at all, I was very frightened for my own health. And that was when I persisted with my doctor, my internist, and began to see a preventive cardiologist who ran more tests related to diagnosing heart disease.
Typical symptoms is what we have been taught in medical school: cardiac pressure over the left side of the chest, shortness of breath, being sweaty or hot feeling, flushed feeling. And then typically the pain or that pressure can radiate down the left arm. Female patients have much more subtle types of symptoms. They may not have chest pain, they may be more fatigued, they may have nausea, they may have back pain, jaw pain, not necessarily left-sided pain, maybe more right-sided pain or more in the middle of the chest.
I went to see a preventive cardiologist, and he ordered an NMR lipid profile. And what we learned from that was that my small, dense LDL particles were very high.
The whole key about coronary artery disease is actually making an early diagnosis. Part of the challenge we have, and one of the things that we're trying to change here, is educating women to come forward as soon as they think they have symptoms of heart disease, because we can actually impact their outcome, we can improve their mortality. And the reality is that any delay in presentation will be linked with a higher mortality rate.
After learning the results of my NMR and discovering that I am in fact at very high risk, I had a CIMT done and learned that my carotid artery walls are thickened.
When we're talking about diagnostic tests for coronary heart disease or coronary artery disease, there's some broad categories. They're the non-invasive tests. Non-invasive tests include things such as a treadmill exercise test, what we call myocardial perfusion imaging test, CT angiogram, A cardiac MRI is also a non-invasive test, and there's been some beautiful studies done looking at correlation of the gene expression test with the probability of obstructive coronary disease. And then on the other end of the spectrum is the gold standard, which is a coronary angiography or cardiac catheterization.
When I was given all the information about my risk factors and the possible negative outcomes, I was absolutely terrified, and frankly, I felt very isolated. Before WomenHeart, I had a wonderfully supportive friend network and family, but I felt strongly that I needed to connect with women who shared my heart concerns, my health concerns, and who were working to better their own hearts.
When we're talking about lifestyle changes, it should really be applied to everyone, universally. Don't wait till you have heart disease, don't wait till you have symptoms, don't wait till you have risk factors. You should be living a healthy lifestyle.
First of all, I'm very careful about my medication, make sure I comply. I communicate a lot with my doctor about how I'm doing, what tests need to be done. And in terms of my lifestyle, I've become more active. We, as a family, take a walk after dinner. I call it healthing up meals, you know, adding vegetables where I can. And I'm very, very lucky in that my family has been behind me.
Now, we all know that that's very difficult to do in everyday life, but the more you can exercise, the more frequently you can exercise, and the longer you can exercise, the better your health.
Managing my disease has not been as difficult as I thought it would be.
The ideal patient for me is someone who comes into the office and is absolutely engaged, asks the right questions, wants to know how to get better, and then when I prescribe a treatment course, they follow it.
What I know is that so many women are working toward heart health, and that I'm not isolated.
I think we're in a very exciting time. We've seen an enormous amount of progress over the last 2 decades, and I think we still have a long ways to go, but we're making progress and we're seeing it. We're seeing it in terms of improvement in outcomes of women. The mortality rates are coming down.
I'm actually very, very lucky to be able to have this opportunity to live a healthier life.